Good morning to everybody. I have to tell you, for me, it's not good morning. The sun has set here. I'm living in Israel now, where I moved in August with my husband to be with our two daughters. So I'll explain a little of that when I explain my position here. But right now, the sun is set on the Mediterranean because I live right on the sea, and it is getting dark outside. So I also understand there's been some dramatic weather in the United States, and I also am glad to hear the tsunami warning has been canceled, I believe, for the West Coast, for those of you who might be on the West Coast. Welcome to this short webinar about the fourth edition of my book, Professional Nursing Concepts. Just to give you a little background about me, because not to brag about me, but more I like to know who I'm talking to when I hear a presenter. I've taught for more than 35 years, mostly in the areas of psych, mental health nursing, in community health, in health policy, leadership and management, and quality improvement, both in classroom and in clinical settings. And I've also held some academic administrative positions and participated in leading some accreditation processes for schools. I taught a lot online and developed online courses. But my first love has always been writing, and I started writing at a very early time when my instructor, and when I was in BSN program, suggested I send off a paper for publication, and lo and behold, it got accepted. And so that was very nice, and it got me into writing. I received my master's from Yale University. I won't tell you what year, but a long time ago. And so now here in Israel, I have a visiting position, and here this university system is a British system, so they use terms like lecturer, and you see on the name Faculty of Health Sciences. There are no colleges in the universities. This is typical what you might find in UK or in Europe. Ben Gurion University is in Beersheba, which is about an hour and a half ride on the train for me. I don't go there regularly. I primarily work with faculty to help them publish in their writing, giving workshops and working with individual graduate students and faculty, and sometimes I lecture. So whatever they want me to do, I give it a wing. So that's me right now. So let's find out a little bit about you so we can get started. We have a couple of poll questions that we'd like for you to answer, and then we'll share back the results, and then we can get into the content. So we know who's out there today. I know there are a lot of different people. The answers are coming in, and Jen's monitoring them.
Great. Okay, I'm going to close the poll. Anita, you can tell me, can you see that on the screen?
Yes, I can. I can see it. Okay. I don't know if other people can, but.
Okay, great.
It looks like we have 38% from BSN programs, okay, and 25% from RN BSN programs, and combination, 21%, and associate degree, 17%. I have to tell you, this is the market for this book. This is the audience for the book. It's what the book was written for. And it's amazing how the percentages came out what I would envision, or we envisioned certainly many, many years ago when the first edition came out. So what about the next poll? Jen will put that up for you. Okay. I wish we could ask now, for those of you who are not using it in your beginning course, what kind of courses you're using this in. If some of you want to share that later in the comments, it would be great. Thanks, Jen. Can we go on to the next slide, and then we'll tie this in with that. I hope I haven't lost you. There you are. Okay.
Good, you see it. Do you see that it says a fourth edition, Anita? Are you on that slide?
No, I don't see that slide. I see the poll.
Oh, you
So,
do?
yeah.
Okay, hold on 1 second.
Just want to make sure we got it on the. Okay, now I see the poll. There we go. Nope. Fourth edition. Okay, got it. Okay, lost it. Go back. Go forward one more. There we go. Okay, this is the fourth edition of this book, and the content is a mix, as you well know if you've looked at the book. It's certainly ideally suited to beginning nursing students, and I recognize that for those of you who are in BSN programs, obviously they're not beginning nursing students because they've been a nurse or they are a nurse, that they may be getting introduced to a different viewpoint or more expansion of their ideas of the nursing profession. The fourth edition, you know, if publishers make decisions about editions using a variety of reasons. Some of them are data-driven, you know, how many people are buying the book, but we still have to think about the content and whether or not there's a clear need for another edition. This book, we decided to do a fourth edition, and some of the reasoning behind it, from my perspective as the author, was the growing need to develop leadership at all levels in nursing education. And one of my deep concerns is that we tend to emphasize leadership at the end of our nursing programs, and we miss a lot of opportunities to get students to engage in that topic as they're going through their nursing education. And hence, in this textbook, whether you use it at the beginning or the end, there is a great emphasis on leadership. And students need to understand the complexity of the nursing profession, whether they're entering the profession or expanding their careers, such as in our NBSN program. And obviously today we have serious questions about the quality of care in the United States. And we know that the United States does not rank high globally. And so we need a lot of work to do in this area, and we need to get nurses prepared for this. So we got work to do. And then we need to look at the next slide, which Jen will switch us to. This text is technically for beginning nursing students, as I said, but also for RN BSN students. And as I noted here, it continues to focus on these major areas: the nursing profession, leadership, quality care, and the 5 healthcare professions core competencies. For those of you who may not know what these are, these were identified by the Institute of Medicine, which is now referred to as the National Academy of Medicine, some time ago in a major report that they published. And the key emphasis in this report and these core competencies was that all healthcare professionals needed to focus on these core competencies, not just nursing, not just medicine or pharmacy. And so this book has a chapter devoted to each of these core competencies, and the content is integrated into the content in other chapters. And we'll discuss a little bit about that as we get to them. We need to recognize, as noted in the next slide, that we have a lot of healthcare trends. I'm sure we could all have a very vibrant discussion today about Affordable Care Act and where this is going, et cetera, and the health policy around this. But as for faculty, we need to get our students prepared to make sure they have the right kind of information about healthcare trends and the impact this has on them as students, as well as on the nursing profession when they begin to practice after they graduate. And so we move from that in this book to looking at how is the book designed? How is the textbook designed? Basically, the chapter features have not changed radically. There are some new additions for those of you who have used this book before. There are chapter objectives to guide the student and you in the preparation for reading the chapter. And there is a detailed chapter outline, again, setting the stage for the student when the student reads the book and uses the book. There are key terms which are also listed and highlighted in the chapter, and then the student can use the glossary to find definitions if need. And there is an introduction to every chapter. The next feature is a new addition to the chapters. I call them the stop and consider statements. After every major header, there's a simple statement. It is not a question. It is simply a comment made that relates to some aspect of the content that the student just covered. It does not necessarily mean that's the most important point, but it's something for the student to think about and to pause in their reading. There are obviously figures and exhibits. Some of these are new or have been updated, and then there is the chapter content that goes along with these features. Now, we have one more poll question here. Do you think most of your students have a realistic understanding of the profession of nursing when they enter your nursing program? Oh, sorry, excuse me. We have a slide before that. I added this slide in because I wanted you to get some ideas about what the stop and consider statements were. They are numbered within a chapter so that you can easily refer to them. And they're very simple statements, like the first one: every nurse is expected to meet the QI competency. The student would have read information about this that came before, and it should give the student opportunity to pause and think about that statement. Or the last one there, which is rather a significant one: stop and consider number 2 for the chapter in ethics and legal issues. Nurses and other healthcare professions have participated in unethical and legal practices. The student will have already read examples of this that came before, and so now can stop and think about what that might mean. On the next slide, Jen.
So, Anita, we didn't include this, the poll.
Okay, that's fine. Okay, we can just go on to the next slide. Now, the other new feature, which is a little weird, okay, and I'm very much into engaging students into the learning process. I do think it's a major weakness we have, and also into creativity and innovation, because they need to be able to do this as nurses. And so each chapter now has what's called a working backward case. And what they have to do is I give them a series of questions it comes at the end of a chapter, and they have to write the case scenario, a case scenario, there's not one, that might go along with these types of questions. And here you see one for chapter 12. Can you provide us with comparison data for the last 5 years? Was the procedure followed as described and based on best evidence? What roles should staff nurses assume? What kind of case scenario might students develop around this? For example, they might write a description of a team working together, looking at their QI. They might write a case scenario about the staff from the QI department, looking at certain features of QI. Chapter 12 is about quality improvement, okay? And so the student will have had a lot of information presented in the chapter to help them consider what kind of case they might write. And in doing this, you can then turn the tables. One team could write the case or the scenario, and they could then give their scenario to another team of students to answer the questions or to figure out what they would need to answer the questions. So again, it's trying to induce some creativity and not your regular type of case studies that we use. Okay, Jen, you want to switch here? Okay, preparing this textbook addresses critical nursing issues, obviously to prepare students to enter the nursing education too. For example, there is a chapter on being a student. You know, what do you need to do about managing your time? What clinical is like? What simulation is like? How can you make the most out of it? Now, I know for those of you who are in RN/BSN student schools or programs, your students have already been nursing students, but it doesn't mean they can't improve their student needs and skills in order to be more effective. We obviously need to identify important nursing professionals' concerns, and they are included in this chapter. And as we've said, understanding the healthcare delivery system. Even if you're an RN/BSN student, those two things are very important because we need to expand their view of the profession and the healthcare delivery system, and also to make use of their experiences that they've already had and try to further develop their viewpoints and their competencies. Jen, you want to change to the next slide? Okay. One thing the book does, which is at the very beginning, is we talk about nursing history. Now, I've had students say to me, well, why do we have to look at history? You know, this is not relevant to me being a nurse and practicing and caring for patients. It's our role as faculty to communicate to them that any profession, including nursing, has to understand where it came from and where it's going. And we certainly can use our history to have a better understanding of that. So there is a chapter that focuses on history, both on healthcare delivery history as well as the profession's history, to help to give the student some context for the profession today. We cover the nursing student role, emphasizing that not only do we as faculty have roles and responsibilities, but nursing students do too. The healthcare delivery system, and I mentioned the healthcare profession's core competencies, as well as leadership and the future. Now, we all know about the Future of Nursing report, but now we have a progress report that tells us we got more to do. So students have to understand, and this is a great example for students, to see how a profession first describes what they should be, and then steps back and evaluates where they are. This is applying quality improvement into the profession. And as students, as well as graduates, and as well as faculty, we have to constantly do this to be a profession. That's one of the characteristics of a profession. It's able to evaluate and make changes. Jen, you want to move to the next slide and see? Okay, now, as I said, the book, the textbook, and these sections have been there from the beginning, and not just in the 4th edition. The first group of chapters, 4 of them, focus on the profession of nursing, and here you find content such as the history and how to be a student, the roles, responsibilities. There's information about nursing education, and students again wonder, why do you include information on nursing education? I already picked my program, I'm in it, I'm going along. And again, this is a time for us to emphasize every professional nurse needs to be constantly aware of what's happening in its profession's education, even after graduation, because we have a role to play in influencing that education by giving feedback, participating in it, maybe becoming a faculty member, etc. The next section is on the healthcare context, and here we help students look at healthcare delivery. We look at aspects of health policy, legal, ethics, etc. And then the The third section is on the healthcare core competencies. There are 5 chapters, for example, on patient-centered care, evidence-based practice, quality improvement, technology, etc. And then the last chapter is on the practice of nursing today and in the future, where a great emphasis is placed on leadership, though leadership is a theme throughout the textbook. You want to change, Jen? Okay, now, for those of you who have used this textbook, I'm sure you're wondering what's new content, what's expanded content. Obviously, if you've not used this textbook, you may not have that question. You just want to know what's there. The next slide or two describes some of the new or expanded content. Just to give you an overview, they're in no specific order. You can certainly look at these in more detail, but I'll just highlight a few of them. There's a new federal informatics strategic plan for healthcare. We need to know about it. We need to participate in how it's implemented. Clearly, we need to look at all aspects of quality care, such as patient safety, and how we go about ensuring that. We need to know more about stress, and so the NIOSH stress model is in the textbook, so students can look at their own stress levels as they practice. I include some information about the Student Nursing Association, as well as other nursing professional groups. And so I have some of the resolutions in there from one of the years, which happens to be 2016, so they can understand what are some of the interests that student nurses have. I have dress code and image, because these are all very important issues. So you can see as you look through here, there's a scattering of topics and of new and expanded content. Clearly not all the content in this textbook. In the next slide, we see a few more, and here you see a little greater emphasis on some of the QI issues. We see patient safety burnout. Students need to understand that they can get overwhelmed with all the QI requirements and what they might mean. Alarm fatigue, what is that? What emphasis does it have? Why? What impact does it have on you as a nurse? On workflow, another hot topic. Family presence, we all know this is an important issue today and goes along with patient-centered care. There's information in there now on the CMS 30-day readmission requirement and monitoring. We need to understand that as a nurse and what impact it has on nursing and the budget, etc. So there's lots of information here related to this. In the next slide, I have a few more. I've included incivility and bullying, because we know that there's a huge problem with this, and it's present not only in the workplace, but it's present in nursing programs between and among students and faculty and vice versa. And so we need to get it out and talk about it. We have nursing workforce issues. We have to develop cultures of safety, and we need cultures of safety in our schools of nursing. So this is a good way to start talking to students about that. So these are just some further examples. And in the next slide, we get to our favorite topic. When you write a book, one of the disadvantages is the book is written. It takes a while to write a book, and as Jen can attest to, as well as Liam, it takes a while to get the book out, the production phase. So by the time the book gets out, there clearly are some topics that might change. This is one, and I can tell you when the book was moving into production, and clearly the government in the United States was moving toward, would they not make changes? Would they repeal it? It was very unclear. I worried about this topic, and I worried with Amanda, the nursing editor, wonderful nursing editor at Jones at Bartlett. And we did have a solution. and I'm going to talk up to you about the solution for how to handle changing this content, because it has changed since the book was published, there's no doubt, though I'm assured there will be other changes. So we will get to those solutions in just a few minutes. But this is a very important topic. It is spread throughout this textbook, and students need to understand the implications for themselves as nurses, for healthcare delivery, and for the patient. And the next slide, I want to talk about the end of chapter features. We had the beginning ones earlier when I mentioned the introduction and the objectives, outline, etc. At the end of every chapter, there is a listing of what's something called the chapter highlights. It's a bullet type list, a few sentences and then another bullet. And it identifies some of the key points in the chapter, but clearly not all the content. And so students can use that to go back and kind of review what they've read to point out some of the key issues. And then we have a section which is called engaging in the content. And I believe this, I think I changed this terminology in either the second or the third edition, probably the third, because I like the word engaging. I think it means we have to involve. And we do have to get the students involved in this content. Just reading it is not enough. So there are extensive discussion questions, and some of them have been in all the editions. Some are new, or some have been changed, but there is a listing. There is also a group of what's something called the critical thinking activities, and these are more require the student to more engage in the content, to find information, discuss information, share information. In both the discussion questions and the critical thinking activities, I do include suggestions for non-traditional classroom. In other words, the online. You know, I've certainly taught online, so I know that works. In addition, I use the term team and teamwork and not groups. Why do I do this? Because when students work in the hospital as students, or when they graduate, nobody talks about groups. We work in teams, right? Nursing team, the healthcare team, medical team, whatever team. So they need to understand that terminology, because that's what's used. And so I use those terms. So I encourage a lot of teamwork and team discussion in both the classroom and online. The third item is electronic reflection journal. You can do this in many different ways. I suggest it's done by the student on their computer. If you want to see copies of it, you can have them send it to them. It's like keeping a diary. And I have suggestions for questions or thoughts they might consider. I suggest, if you use this textbook from the very beginning of the nursing program, that the students are encouraged to continue this journal throughout their nursing program, because they can see differences in how they've changed, what they've learned, their experiences, etc. The fourth item are case studies with questions. There are some new case studies, and there's some case studies that have been in other editions, and these are short scenarios with a couple of questions. They can be used by students individually, though I encourage team discussion, teamwork. The next item I already mentioned is working backward to develop a case study, and that's included in the end of chapter features. And then, of course, the references, which have been reviewed and updated for this new edition. In the next slide, I want to get to something that's very new for this edition. Jones and Bartlett kindly let me develop this for a book I published a year ago on quality improvement. And so we decided to carry it forward, the features, into this a new edition. And that is a little bit more innovative teaching learning practices to engage the student. When you go into the website for the textbook, monthly, I post, I don't post it myself. Wonderful people like Liam or other people post it. I write it. I have 3 different components to it. The first one here listed is a blog, Finding Your Way in Professional Nursing. I pick a variety of topics and I write personally about them, not in a formal way. I have a second section, which is current literature review. I take one article, I write a short summary of it or comments, and I list questions and I give the citation so that students can go to the article, read it, and consider some of the questions. The third aspect is engaging students in the content, and this is for you. The other 2, the students can access. In engaging students in the content, every month I post updated information. I post resources you can use. They're all non-permission required. They all come from the government for the most part. This is where you find or will find updated information on the Affordable Care Act, for example, or resources you might want to share with the students about the Affordable Care Act. These features are now built in and monthly. This information is posted for you to use however you may choose, and I would encourage the students to use the first 2 to augment their learning, because it's going to be, more current kind of information. In the next slide, I want to talk very briefly about faculty resources. The first 2 are your common ones that you see, and they've been used in this edition, this book, all the editions. The last one is very important because I wrote for this edition an extremely extensive instructor manual. And some of the things you will find in that manual on the next slide are, I've tried to put into the manual some items from the textbook that I know, having been a faculty member, I sometimes would like to copy and print, for the students, or to put in the syllabus or whatever, something like that. So I have the textbook preface there, as it is in the textbook. I have a section called Making Effective Use of a Textbook. I put that there, as well as this third topic, textbook methods, because I know a lot of times we have new faculty who are teaching a course or they've never taught before. And so these are some guidelines for them. I find that a lot of students don't know how to use a textbook. It's amazing. You ask them, well, have you looked in the index? And they look at you like, what is an index? And so that's covered in the first couple of sections. I have in addition to the end of chapter, okay, application of chapter features, discussion about how you can apply them. And I have a section on applying the chapter appendices, which are found in the textbook, and some general suggested teaching learning practices that you might use per chapter. These are all given in a lot of detail. And so they really are an augment to this, this textbook. In the next slide, I also have added additional case studies, and some of these case studies are applicable to multiple chapters, and I have indicated which chapter. So there might be a case that can be used in combination with chapter 1 and 2, something like that, okay? I have listed the chapter objectives, again, and the outlines, because sometimes I know you need to use them for some of your documents, and this way you can get to them and copy them, where you can't do that very easily from the textbook. And as I said, there are additional teaching and learning practices per chapter. There's an example of one in-depth written assignment, more, not short paper. And this obviously you could use or you could adapt, and there is evaluation guidelines to go with it, how you might configure your points for evaluation, etc. So this is the new book in a very short nutshell. I would say if I had to summarize, there's a lot of new information, there's a lot of expanded information, and there's a lot more resources for you to use as faculty, the digital as well as that I mentioned, and the instructor manual, but also there's a lot more for the students that they can get very engaged in this content if you direct them to it. Obviously, the digital components, you would have to direct them to it because they're not in the book. But that's the whole idea, because they can get in there and mess around with it online. Excuse me. And the last key messages for today is, one, we need to engage the students in the content, and this requires us as faculty to plan and be very innovative in how we facilitate learning. We need to leverage as many different ways of getting to the students as we can in their practices we use to enhance learning. And we need to prepare them for their transition to effective nursing practice, and for those in our NBSN programs for more effective nursing practice. And we require that our nursing profession have active learning that never ends. And so we need to start that here. Now, I know that Liam is going to go over in the next few minutes the navigator, and I hope I've left him enough time here. I'm going to stay online here, but I'm going to turn it over to him so he can explain what the Jones and Bartlett system is, which is a wonderful one. Thank you.
Great. Thanks so much, Anita. So you will just see your screen change slightly while we give Liam the presenter control. And Liam is going to demonstrate Navigate 2. So at this point, I'm going to turn it over to Liam.
Thank you, Jen. Thank you, Anita. Today I will be demoing Professional Nursing Concepts 4th edition. This is our Navigate 2 course. Just before I get into the demo, I just wanted to quickly mention that access to Navigate 2 comes free with every new textbook that is purchased. And we also have digital access only to Navigate 2, which can be purchased at a discount. You can also request a trial course for Professional Nursing Concepts or any of our other nursing titles with your account manager. And we can also set up a full demo to go over the Navigate 2 as well. Today, we're just going to do a quick demo just to show you what comes with Navigate 2. And then in addition to being able to access Navigate 2, we do have an integration feature with Blackboard and Canvas that is available as well. So this is the main page of Navigate 2. Once you log in and once your students log in, you're going to be brought to this Lessons tab right here. This is really the main page of the course, and this is where most of the content is found. Right now we're in as an instructor, but when your students log in, they're going to see pretty much the same things that you have here, and you can always preview the course as a student if you need to. So the student resources that we've added in, if we scroll down, we have from the author. So this is where you're going to find the 2 student items Anita had just spoken about in the professional nursing blog and the review of current literature. So students will be able to come over here and they can download it. And then what we have done is, and I'm going to show you the Word document in a moment here. Oops, sorry, one moment while I share the screen here. So this is the blog. This is how it's set up. Every month we do update it. So as you can see here, if we scroll down, you can see February 2018, we updated it. And then you can come over here and see the past blocks that have been entered. So if you come back here every month, this will be updated. Okay, and if you give me a moment, I'm going to jump back to the course. So now that we're back in the course, same thing with the review of current literature. If you come over here, you can download it, and you're going to get all the monthly entries in here. If we go over to a chapter, we click on it, you see all the content that we've pre-built for you. So right out of the box, it will come with interactive lectures that we've added in to each chapter. So any of our premier courses for nursing titles will come with these interactive lectures that we created. These are available for students to go through on their own, and there are a lot of interactive features that are in here. Throughout the interactive lecture, they have a table of contents, and we have added in, if we jump back to a knowledge check question, we have added in some questions for students to go through as they're going through the interactive lecture. And then they can come over and see if they got it right or wrong. If they got it wrong, they can come back, try again, and then it's going to give them the right answer, as well as explain, more about the other choices there. So these are really designed for students to come in on their own. It's a great way for them to go in and learn the content in another manner. So, they're not just going through PowerPoint slides. These are more interactive, more engaging for them. And then you'll find the other content we've added in, like the learning objectives. These are downloadable for students. We have the ebook. So if we come over here and open up the ebook, it's a digital version of the textbook. In addition to reading the ebook on the computer, we do have an app as well. For this particular title, it's called Navigate eReader 2, and students can download it on the Apple App Store for iPhones, iPads, and the Google Play Store for Android phones and tablets. And that's how they can read the ebook on a mobile device. So if we come over here, you can see we've set up the ebook. It looks very similar to the actual textbook, but you can come over here if you need to. You can change the size of the text and it's going to reflow. You have the capability of coming over here and highlighting. So you can add in highlights, you can add in notes into the ebook, and it's very easy to do. As the instructor in the course, you do have the capability of sharing your notes if you choose to do that. And then over here on the left, we have search, so you can search for keywords or terms. It'll show you everywhere where that word is used, gives you a small preview, and if you click on it, it's going to highlight that word for you. And then we have contents, so you can access all the content in the book. First, you're going to see the table of contents, so you can jump right to that page. We also have any bookmarks, so if you've added bookmarks, you can jump right to it here. And then enrichment. So this is actually going to bring you to the different figures within the book. And then if we come over here, we can make these items larger. So it makes it a lot easier to see. And then finally, we have added in knowledge checks into the ebook. These are ungraded questions that are available for students to go through. It's a great way for them to just check their knowledge as they go through the book. So they can come over here, they can see if they got it right or wrong, and then they can check and see what the right answer is. And if they want to retry it before checking the right answer, they can do that as many times as they want to. And then we have also added ebook quizzes into the ebook. And these are also available outside of the ebook. And these are graded quizzes that we've added for students to take. These are available right away. And these will report into the gradebook once they're done and submitted. And then finally, we do have a built-in glossary. So you can come over here, click on glossary, and you can see all the glossary terms within the book. And as students are reading the ebook, they can click on any of these dotted underlined terms and pull up that definition as well. If we come up here, you see we have learning tools. This is going to be the same content I just showed you, but you have the capability of seeing it in a different order. So we have all the flashcards together in one place. You can pull up all the lectures together in one place. And these are available for students to see. And then we have teaching tools. So this is where we can come over and we can see the items that are just available for you as the instructor. Students will not have access to this. So this is where you're going to find items like the instructor manual that was mentioned before, the instructor resource guide, as well as that engaging students in professional nursing content. This is the item that will be updated monthly, and this is just available for you. And you can come over here, if you click on launch, you'll be able to download this item. And then we have reports and grades. Grade of report, this is where you can see the full grade book. User report, this is where you can come in and see the grade book per user. So if we go to grade of report, we'll be able to see all the students who are in this course. If you do any assessments or quizzing or assignments, you'll be able to see all the gradable items here. And if you need to review it, you can just click on the quiz in this case, and we can see who's taken it, when they started, when they finished, and how long it took and what grade they received. And if you need to review the attempt, you can come over here and do that. Now, if we go back to the course, if you need to add in your own quizzes, into the course, you can very easily do that. If you come over here and go to add an activity or resource, come to navigate to assessment, this is where you can come in and create a quiz. So I'm just going to go through it quickly. Once again, we can always do a deeper dive and a full demo, and we can walk through everything step by step. But first we just have to name the quiz. We can set up all the settings in terms of dates and times. And then we can pick the questions that we want to add to this assessment. So if we come over here, you can see the question bank that we've added in. We have separated the questions in terms of suggested quizzes to use, suggested midterm and final, and then finally practice activities. Now these practice activities you can use however you want. You could add them to a quiz or graded final. These are really just additional questions that we have separated here. So if you wanted to create a very quick Chapter 3 quiz, you can add all 10 questions and you can do that. But now with the practice activities, you have another separate 10 questions you can use elsewhere that your students have not seen yet. So they can very easily be added to an exam or a multi-chapter test if you want. And then finally, if we come back over here, all these blocks are customizable. So individually, if you open it up, if there's any content you want to hide from your students, you can very easily do that, and you can see it becomes grayed out. So anything that's grayed out, students are not able to see. And then if you need to, you can hide an entire topic. So if you're not teaching that chapter, you do have the capability of hiding that. And then in addition, other things you can do, you can add in your own topics into the course. You can rearrange the chapters. So if you don't teach in the order of the book, you can very easily have that reflected within the course. So once again, that's a very brief overview of what you have available in Navigate 2. If you'd like to request a trial course or a demo, please reach out to your account manager. At this time, I'm going to pass it back to Jen.
Great. Thanks so much, Liam. So at this point, you will see the screen turn just a little bit because Liam's going to give me the, yep. So you should see the slide that says Navigate to Premier Access. So if you would like to learn more about this product, you can visit jblnavigate.com/2. And as Liam just noted, if you would like more of an in-depth product demonstration, please reach out to your account representative as well. And at this point, I would like to just remind anyone, if you have any questions for Anita or Liam, we're going to stay on the line. As we mentioned at the beginning of the presentation, the textbook just published in December. So if you would like to request a review copy, you can visit go.jblearning.com/PNC4E for the 4th edition. And Anita has been kind enough to also share her Gmail address with you. It's anitafinkelman@gmail.com if you have any questions. She's more than happy to respond to anything that you might ask her. I think we do have a couple questions here, so you can just find my name in the chat pane. We do have a question, Liam, and this comes from Lynn. She's asking, with adaptive quizzing based on students' needs or adaptive compensation, how easy is it to manipulate specific aspects of Navigate 2?
It is you can easily customize, Navigate to. You do have the ability to go in and either add in your own questions or edit the questions that we have. We don't have adaptive quizzing within the course where it changes based on how students respond, but it is very easily customizable. You can add in and change a lot of things, within the course. And that's something we can always set up, in a one-on-one session, we can go into, how much you can customize exactly, and if what you need to do with your course, we can work with you on that.
And Lynn, my apologies. I know that I think I read the third part of your string first, so my apologies. So we definitely can work with you to give you, I believe it's trial access to the 4th edition, because she's using the 3rd edition currently. So Liam, we could give her trial access to that. Is that correct?
Yes, we can certainly set up trial access to the course. We don't have an integration directly with Moodle and Navigate 2, but that is something we can always talk with you and see what other options we have to assist you, if you need it to use your own, to use Moodle for the course. We can work with you on that.
Okay, great. And she was asking about the Moodle integration as well.
Yep. Currently, it's just with Blackboard and Canvas. We have the integration that links the two directly. So, you could click on a link in Blackboard and it will log you in to Navigate 2. But if you use another learning management system, there might be other options that we have to assist you. We do have a lot of instructor resources, which can be uploaded, into your learning management system. And there's other things that we might be able to do to help you as well.
Great. And Liam, I don't know if we just covered this. We have another instructor asking, can the resources in Navigate 2 be imported into Moodle?
We do have a lot of resources available right now that can be imported into Moodle. In terms of having the test bank into Moodle, I'm sure that's something we can work with the editor on to see if we can get the test bank set up to be imported in Moodle. We don't have something right at this moment, but our editor is very good at getting something like that set up for those who need it.
Great, thank you. So at this point, it doesn't look like we have any additional questions. I do want to thank Anita and Liam for their time today and for everyone who's joined us. Anita, I don't know if you have anything else that you want to close with today?
No, I just thank everybody for attending and Liam for sharing about Navigator 2, which is an important tool for faculty. And I wish you the best. Take care.
Great. Thanks
Thank
so
you.
much, Anita. I appreciate that. And you will be receiving instructions on how you can download the PowerPoint slides as well as the sample chapters. If you didn't already do that, they're located in the handout pane as well. And so big thank you to Anita and Liam today. And we look forward to hosting you again on another one of our webinars. Have a great day, everybody. Thank you.